12 to 15-year-olds are now on the list of those who can get a COVID-19 vaccine. For parents of tweens and teens like Aaron Turner, it's welcome news.
First, I am really sick of living the way that we do. Second, I believe in the science behind it. If it's good enough for me, it's good enough for my children. And third, these kids have already lost out on so much.
The FDA's emergency authorization of Pfizer's mRNA vaccine comes after a study of 2,200 kids showed it was safe and worked as it did in older people. Doctors say there's no evidence this vaccine will affect development or fertility in the long run.
There's no mechanism for a vaccine to have a long-term effect. Once it's done its job, it's gone. It's no longer in your body. All you have left are the antibodies to the spike protein. There's no vaccine left.
The efficacy of the vaccine in 12 to 15 years old was essentially 100%, and it was really quite safe.
Dr. Anthony Fauci said the vaccine will be available for kids, quote, almost immediately. As for what's next, an advisory committee from the CDC meets Wednesday on whether to recommend vaccines for the 12 to 15 age group. Doctors will look to that before putting shots into arms. Kids younger than 12 still have to wait. Trials are staggered and going on for younger age groups because kids' immune systems are very different from 3 to 6, 6 to 9, and 9 to 12. The FDA meets next in June about COVID vaccines for those under 12. Health experts tell Newsy they think at this point, kids 12 and under are looking at getting vaccines end of 2021, early 2022. So what should parents do right now? They need to be calling their pediatrician to ask where they can get their kid vaccinated. The American Academy of Pediatrics tells me that some pediatricians are administering COVID-19 vaccines within their practice, but others are going the route of coordinating with public health departments and other places to make sure that their patients have access to the vaccine that way. However their children are vaccinated, parents need to be talking about this with their pediatrician so that their child's medical record can be kept the most up to date. Lindsay Thies, Newsy, San Francisco.